Hey, let's break down aplastic anemia, a rare but serious blood disorder that can really turn life upside down. So here's the deal. In aplastic anemia, your bone marrow basically goes on strike. It just stops making enough blood cells, not just red, but also white blood cells and platelets. That means your body is running low on the stuff it needs to carry oxygen, fight infections, and stop bleeding. Why does this happen? Most cases are acquired, meaning they develop later in life. Some meds, like chemo drugs, chloramphenicol, and sulfonamides, can trigger it. So can certain chemicals, like benzene or pesticides, and even radiation. Viruses are sometimes to blame, like certain hepatitis viruses, EBV, HIV, or parvovirus B19. Sometimes the immune system just decides to attack the marrow for reasons we still don't fully understand. And honestly, about half the time, there's no clear cause at all. That's what we call idiopathic. There are also rare inherited types, like Fanconi anemia or dyskeratosis congenita, but those are way less common. Now, what's actually going on inside the body? Well, the stem cells in your bone marrow get damaged, so they can't produce enough new blood cells. Fewer red blood cells means you might feel tired, pale, or short of breath. Low white blood cells leave you open to infections. And with fewer platelets, you bruise easily, get little red spots on your skin, called petechiae, and bleed longer than normal, even from small cuts. Importantly, there's no spleen enlargement, which helps set it apart from other bone marrow issues. Diagnosis starts with a blood test. You'll see pancytopenia, which just means all 3 cell lines are low. The reticulocyte count is also low, showing the marrow's just not keeping up. If doctors do a bone marrow biopsy, it'll look empty, mostly fat instead of cells. They'll also check for viruses, autoimmune conditions, or anything else that might be behind it. Treatment depends on how sick you are and how old you are. Supportive care means blood transfusions when you need them, and being super careful about infections. The big guns are stem cell transplants for younger folks with a good donor match, or immunosuppressive therapy if a transplant isn't possible. And if meds or toxins are the culprit, you've got to stop those right away. Sometimes growth factors can help boost your counts. Quick exam tip. If you see pancytopenia, hypocellular bone marrow, and no splenomegaly, think aplastic anemia. And hey, if you want a super simple chart comparing aplastic anemia with megaloblastic anemia and leukemia, just let me know in the comments.